Welcome back. Ahmed in Oakland, California, watching Free Speech TV. You're on the air with Wendell Potter.
Yes, sir. I live in Oakland, California. I have a comment and a question, if you don't mind. First of all, I love your show. I watch it every single day.
Thank you.
And my comment is, if I work for a business for about 10, 15 years, and the business goes out to business, then I am on my own. I have no insurance, and the only way that I can is through the Obamacares, I call it. Obamacares, not Obamacare. And the second question is, regardless of whose party that shuts the government, the congressmen and the senators, would they get paid?
Oh, yes, I can answer that question. The Constitution was amended some time back to say that the pay of members of Congress can only be modified in, if Congress votes itself a raise, it can only get that raise in the next congressional session. So it's impossible for Congress, and that's what their intent was. So it's impossible, but the result is that it's impossible for Congress to vote themselves a pay cut. That happens now. They can only vote future members of Congress a pay cut. So they can't cut off their own pay. So if the government stops, congressional pay continues. With regard to the question for Wendell, let me toss that to you, Wendell.
Yeah, again, the good thing about the Affordable Care Act is that if you've lost your job because the company you work for closes, or for whatever reason, if you happen to be unemployed and then lose your coverage as a consequence, or for whatever reason, you can now apply for insurance that will start the first of next year, and depending on your income, may be able to get help from the government to pay for your premiums and even your out-of-pocket expenses. So be sure tomorrow to go to healthcare.gov or coveredcalifornia.gov and check out what your options are. You might, as we've noted before, even qualify for the expanded Medicaid program in California. Let me modify one answer to another question, Tom, regarding the open enrollment period. There will be special circumstances that will be considered if you, for example, and this is true in the business world too. If you are getting your coverage to the employer, if you get married, if you or get divorced, if there's a death in your family, if you move, there are a lot of special circumstances in your life that enable you to sign up for coverage or change your coverage outside of the open enrollment period. For 2015. The open enrollment period will be from October the 15th to December the 7th of 2014. So it'll be a narrower window, but there will be these special circumstances that will enable people to sign up for coverage outside of that window.
So the times that typically people realize that they need to get coverage, or they just lost their job, just got a job, just moved to another state, those will, the windows won't matter.
That's exactly right.
That's good news.
Yeah.
Wendell Potter's with us. He's answering your questions. We'll be back with more of your questions for Wendell Potter right after this. It's 10 minutes before the hour. Welcome back. Thom Hartmann here with you, and Wendell Potter on the line with us. WendellPotter.com is website. You can follow his Twitter feed at Wendell Potter. And taking your call, Steve in Elgin, Illinois. Hey, Steve, you're on the air with Wendell.
Hi, Tom and Wendell. My question is this. I'm self-employed. I'm a musician, fairly low income. My wife lost her job. She's on unemployment. We have private insurance through Humana with very high deductibles. It's really more than we can afford, even at that. It's basically catastrophic coverage. Will we be able to simply drop our private insurance and sign up for insurance through the exchanges?
Yes, you can. you absolutely can do that, and I would encourage you to shop tomorrow and between now and the end of March. But I think you probably can do better. You'll be able to compare one policy against another in ways that you've not been able to do before. You'll be able to understand what's covered and know what your out-of-pocket expenses will be, and you can even drill down to find out what doctors and hospitals are included in a given health plans network. So I think you should shop. I think you may find that you can get a better deal, and it sounds like you probably will be able also to get tax credits and subsidies.
Wendell, just a kind of a side question here. I used to own a travel agency back in the 80s, and travel agencies were necessary because you couldn't go online and buy your airplane tickets. And it was an enormous hassle booking on the telephone with the airline companies, and you couldn't compare things. And travel agents could do that instantly. Travel agencies have been largely put out of business by the internet. Is the Affordable Care Act going to put health insurance agents, those salespeople out of business?
It's really going to change their lives considerably. The column I wrote today for the Huffington Post and the Center for Public Integrity is about that very thing. We're going to see both insurance companies and agents find that their jobs are going to be disintermediated, that they're middlemen that won't be as necessary as they have in the past.
That's interesting. Sam in Point Pleasant, West Virginia. Sam, you got a question for Wendell?
Yes, Professor Hartman. All right, I'm asking for my son, who's 30 years old, okay? He's in good health. He's got a few minor problems where he had his neck broke, but it healed up. Okay, he works every day, 10 to 12 hours a day. He likes his work. He's in good physical shape. To clear $100, how much do you think, sir, he should be charged monthly for his insurance?
Well, I don't think there's a real good way to answer that because it depends on what kind of coverage he wants. One of the things that you'll be able to find when you do shop for coverage beginning tomorrow is there are different levels of coverage, and you'll be able to buy a bronze, silver, gold, or platinum policy, and each one it costs a different amount of money. If you get a bronze policy, your premiums will be lower than if you get a silver or gold or platinum, but you'll have to pay more out of your own pocket if you get sick. So there are trade-offs. You'll just have to determine what works best for you individually or for your family.
Jeff in New Lisbon, Wisconsin. You have a question for Wendell?
Yes, Tom and Wendell Potter. If you would, for those of us who do not have computers, or those of us who are a little bit too old to use computers, if there's a phone number, of either a federal phone number, an 800 number that could be used by those of us who don't have computers.
How does somebody sign up if they don't have internet access? Good question, Jeff.
There absolutely,
Thank you.
Yeah, there absolutely is. You can also call an insurance agent. They're not yet disintermediated, so you can work through an agent or a broker. And I don't have the number at my fingertips, but I can get that so that you can.
So there is a federal toll-free number. Plus, you can just look in the local Yellow Pages and call an insurance agent, and they can sign you up.
Right, or an insurance company directly. But there will be a toll-free number for help for the federal government and the exchanges, healthcare.gov, and we can get that phone number for you.
Okay. Kevin in Chicago. Hey, Kevin, you're on the air with Wendell.
Afternoon. I had a concern with I understand the IRS will fine people or penalize people for not having insurance, and this is something where they want to get all the people in the United States insured. How does the illegal immigrants fall into that? Because they don't even know where they're at. So if they go to the hospital or they go somewhere, are they going to get medical treatment? I know there's a couple questions there.
Yeah.
Yeah, the Affordable Care Act, the way it was written, those who are undocumented residents of the United States here illegally or legally, quite frankly, are not eligible to participate in the exchanges, so they are excluded from the Affordable Care Act. That doesn't mean that they will be turned away from hospitals. Hospitals have long had a requirement that they have to treat people who are sick who show up. in the emergency room. So that will still be the case. They can't turn people away regardless of their citizenship. But
Okay.
the Affordable Care Act does not apply to people who are not citizens.
Wendell, we got a 50-second cue here from Danielle. Mark in New York is asking, can they charge you more if you have a pre-existing condition? I think the answer to that is no.
The answer is no. And
Okay.
by the way, that 800 number is 800-318-2596.
Right. And Jim just handed that to me, and I'll give that out tomorrow as well. And then also Donald in Aurora, Illinois wants to know, how similar is mass health care to ACA?
Very, very similar. The ACA was built largely or modeled after the Massachusetts Health Plan.
After Romney Care.
Obviously some differences.
Yeah.
But they're very different, very, very much the same.
Okay. And then Janet has a question. Can you apply to the for ACA prior to retirement?
This is one of the biggest benefits. I'm not sure exactly what she means, but it's available to anyone if you are going to be unemployed one way or another,
Right.
and you're not eligible for Medicare. You sure can.
Okay. Wendell Potter, wendellpotter.com. Thank you, Wendell.
Thank you, Tom.
It is always great talking to you. I so appreciate you being with us today.